Hi, I'm Alex Molyneux, Chief Pharmacist at NHS Doncaster CCG. I'm pleased to be able to introduce you to our and your new Medicines and Products Directory. After many months of creation by the Medicines Management team, this directory is designed to be a one-stop location for product commissioning information in Doncaster and Bassetlaw. Shortly, there'll be a Q&A and demonstration of use with a local GP. Now, there are some nuances for Bassetlaw prescribers. So before the Q&A, here is my counterpart from Bassetlaw CCG.
Hi, I'm Rob Wise, Head of Medicines Management for Bassetlaw CCG. Thanks to Alex and team for putting this together. Hopefully you'll find it easier to use than the previous system. Most of the content of the MPD applies to both Doncaster and Bassetlaw clinicians. However, there are some differences. These relate to mental health medicines and products which are used by community services. This is because Bassetlaw commissions these services from Nottinghamshire Healthcare, whereas Doncaster commissions them from Ardash. In the MPD where this occurs, Bassetlaw clinicians will find a link through to the relevant section of the Nottinghamshire Formulary and should click through to this. A couple of examples being antipsychotics and wound care, where the links are highlighted. Now I'm going to hand back to colleagues for a Q&A and demonstration of use.
Hi Rachel.
Hi Karen, thanks for joining me today. I'm excited to hear about the new MPD. Can you tell us a little bit more about it?
Yes, the Medicines and Product Directory is a new database that's being developed by the Medicines Management team, and it incorporates the items from the traffic light system and the formulary together, so that when you're looking for a drug or a product, you can find it in one place instead of having to look all over in different places.
Okay. So sounds good. Can you show me where I can find it?
This is the homepage of the Medicines Management website, and the Medicines and Product Directory, as you can see, is in the box where the traffic light system is and always has been. So if you click onto that, so if you was going to the Medicines and Product Directory, the MPD, you would click here, and this takes you to the homepage. There's a little bit of a description of what it is for anyone that's going on there for the first time. And down this side here, there's a bit of an index.
Okay, well, it looks good. I mean, it looks quite easy to navigate, and it kind of seems to make sense being linked to the BNF sections. I can see how it could be quite useful in primary care, perhaps to have it up when you're consulting, you know, in the Internet Explorer or Google or whatever. If
you haven't already got the Medicines Management website as a desktop shortcut, it would be a good idea to put it on, and then when you're doing your consultations, if you do need to look at it, it's at hand. And if you need any help with that, you could ask your Medicines Management staff. So there's a couple of different ways to search for a drug. You can either search for an individual drug here in the search bar, or you can look in a therapeutic section.
Okay, looks good. So for example, if I wanted to look up a PPI, a proton pump inhibitor, which one will be first line to use? How would I go about doing that?
Right, so there's two ways of doing that. You can either do it in the search bar, and you can look for lansoprazole, do the search, and it'll tell you which section it's in.
And those sections, are they like the BNF sections?
They are the BNF sections. Yeah. They mirror the BNF section. So there you go, it's there. But if you wanted to go through the therapeutic section route, so you click on your and there it is. So there's two different ways of searching for a drug. So when you actually find the drug, like you can see here, lansoprazole. So down the side here is the traffic light system key, which is like the old traffic light system key, and they're like the classifications that you're used to, that you've always used. Yeah. Down this bit here, these are whether it's first line, second line, third line, or non-formulary. So as you can see from the drugs here now, lansoprazole capsules are first line, and they're also green. Lansoprazole dispersible tablets are silver, that's second line, but they're still green. Your omeprazole injection at the bottom here is red, because they're more or less always used in hospital, so it's hospital only drug, and it's non-formulary.
So it's a bit of a snapshot, isn't it? You can see if I can prescribe it and what's the first line formulary choice in one screen. So that's quite smart, isn't it?
It is. There is a link to the formulary. The joint formulary that we have with DBHFT is obviously on the website still in the formulary section, but there's a quick link here to the 1.3 for this section. If you click there, all the drugs come up in the on the page of the formulary, and any sort of information guidance that is linked to that section is still there, but that's from the formulary. So
one of the things I do quite frequently look at the medicines management website for is shared care guidelines, especially around antipsychotic medicines, because I know it's quite complicated which ones are traffic lighted red or amber, depending on their indication. Where could I find that in this new product?
It's under central nervous system. Yeah, antipsychotic drugs. If you drill down into each section, there are all the drugs. So the shared care protocols and the AMBER-G guidance that is linked to all of these drugs is here at the top. Now you'll see here Bassett Law CCG mental health, they're under Nottinghamshire. So we've actually put that on as well for the Bassett Law prescribers to look at for their patients. So yeah, you just click on the links, and these will be updated. As the shared care protocols and any guidance is updated, it will be updated on here. So you'll have the latest versions of everything.
So is this sort of like a work in progress?
It certainly is, because at the moment there's all the items from the traffic light system, which are obviously the red, amber, the categorised, that have been through the APC, and the guidance, the formulary guidance items are on, but anything that falls in between that's not on the traffic light system, not on the formulary, but is prescribable but will be non-formulary, they're the items that we're still in progress of updating and putting on.
If I've got any questions or find any issues, how could I let you know about them?
Right, so there is a little page called the feedback page. So if it's a clinical urgent query, you can email the Doncaster RX line, which is manned by the pharmacists in the medicines management team, and they will get back to you really quickly. If it's about why is there a drug missing, or any other sort of technical query, if you fill this form in, this will go to the medicines management admin email address, which then will be passed to me, and then I'll get back to you with an answer.
Looks good. I've used the RX line a few times and I've always had really helpful responses about queries that I'm not sure about, so that's definitely worth noting. Great, well, I'll look forward to having a look at it, and hopefully it'll help me in my clinical practice.